Good morning, good afternoon, or good evening, depending on wherever you are in the world. Let me send my greetings to all of you, fellow nurses and midwives, and just say that we are on the second session. This morning, we had a very lovely opening session. I was with my co-chair, Lord Nigel Crisp. And by the way, my name is Professor Sheila Tlou. I'm the co-chair of the Nursing Now Global Campaign and former Minister of Health of Botswana. So I'm happy to welcome all of you. Our morning session, as I said, we had also our Nursing Now ambassador, Amelia Clark, who was really able to share with us the great work that nurses do. And most of all, we had the opening address, a very motivational speech from one of our Maras and a great supporter, the WHO Director General, Dr. Tedros. So now we are actually on a global space, trying to see where we are and what is happening in terms of the Nightingale Challenge. But I want to tell you that one of the things that came up was really a great presentation that was showing that with the Nightingale Challenge, we have at least 745 employers who have enrolled 27,000, let's say 28,000 nurses, and in 74 countries. And the one thing that we wanted was to say, well, we want more. We want the Nightingale Challenge to continue beyond July 2021, and to ensure that employers keep enrolling those nurses and make sure that we invest in our future leaders. So now we have different approaches in the various countries. And indeed, now with the COVID-19 experience, we have countries who are enrolling nurses in different ways, and that
Just your respective Nightingale programmes.
At Aga Khan University. And Harriet was one of the first graduate midwives to graduate from our university. The challenge for Aga Khan University was to offer a leadership midwives in Uganda. And we initially signed up to offer it for 20 nurses and Aga Khan University to have 80 young nurses and midwives. And here is a very different nurse. Program.
Leaders, Lisa and Anthony, the project is building resilience of midwives and nurses in the community towards effective and looking at building leadership skills that we can build their capacity to handle looking forward to starting soon because the of the lockdown and we hope for our community and for our and we are she's been my faculty at Aga Khan University for 3 years, and then she's my mentor with ICM in the formal mentorship because she has used my capacity. Organization. We are successful in that community. Thank you. To be a proud beneficiary logo, I carry as we also help the nurses now campaign because they don't know about it.
That's wonderful, Harriet. If you could.
Lisa?
Yes.
Start the broadcast. Should only take sort it out, and I think it's worth trying. Yeah. So I'm going to do that.
Okay.
All right, bear with me. Just loading it. Hang on.
Okay.
It's such a shame, isn't it? Because this is such a rich session about people really doing this stuff. But
we still have our audience.
True.
Okay. Yeah. The broadcast has started again, so let's go on and see what happens.
Sheila, so we've just had technical issues and we've just started the broadcast again. So it would be great in the chat box if you could say if this has resolved the issues that you've had. But I'd very much like to move on to. Can Romnick hear us?
Yeah. No, somebody's saying it's working.
Anthony,
yes, we can see you now. Yeah.
Let's go on.
All right.
Oh, fantastic. So can Romnick hear us? Or is Romnick still frozen?
Romnick's still frozen, I think.
Okay. Can Roshin hear us and see us?
Hello,
Lisa.
Yes, I can now.
Hi, Roshin. Lovely to hear from you. Super. Okay, Roshin, your question is how has the Nightingale Challenge enabled you to provide more opportunities for your early career nurses and midwives at Guy's and St Thomas's?
Okay, so yes, so at Guy's and St Thomas's, we were really proud to be able to be involved in the Nightingale Challenge, and we saw this as an opportunity to provide leadership development for a specific group of our nurses and midwives. So in the UK, our Band 6 nurses and midwives have typically been qualified for about 2 or 3 years. So they've consolidated their training, and they're probably at a stage in their profession where they're thinking, well, where do I go now? What has nursing and midwifery? What opportunities are there for me? They've probably been working on a ward or in a particular department for that length of time, and may not know where the other opportunities are for them. Many of them, we know actually that this is a time where they might be considering even leaving the profession. Yeah. So we felt that this was a really important group of nurses to engage and support with their professional development. So we used the Nightingale Challenge. We developed a leadership programme for this group of nurses to really showcase the diversity of nursing and midwifery roles across the organisation. We were supported by a group of senior nurses and midwives who acted as mentors for these junior nurses. So having one-to-one conversations with them, but also providing them with opportunities that they wouldn't ordinarily have had. For example, shadowing these senior nurses. So some of our clinical nurse specialists, advanced nurse practitioners were mentors. So they were able to see them working autonomously with their own patient group. Some of our heads of nursing and our directors of nursing were mentors as well. So they were able to see what it was like in a much more senior and managerial role across the organisation. But this was very much about developing, leading yourself. So we really wanted this leadership programme to be a little bit different to sort of the didactic teaching. What we wanted this to be is very much about the individuals recognising where they would like to go in the future through the support of these mentors, and then developing their own personal development plans so they could really map out the development they wanted. And then through our Nightingale Academy at Guy's and St Thomas's, we offered them the opportunity to undertake a number of different, we had standalone study days such as unconscious bias, having difficult conversations, so that they were able to attend study days that they felt were useful for their own professional development. And then in terms of other opportunities that our Nightingale Challenge nurses were able to avail of, a number of our young nurses wanted to support and really engage our local community. And we do quite a lot around widening participation, and especially where we're getting young people at school age to come in and showcase nursing midwifery. And they wanted to try and take much more of a leadership role within that. So they were able to engage with with our widening participation team, and also some other nurses, a nurse consultant who was for safeguarding within our local community, and to work with her to try and develop some programs for young people to become more engaged with nursing and midwifery as a career in the future. And also then they had this fantastic opportunity to engage with the Nightingale Challenge and Nursing Now by attending webinars. So we shared the webinars that have been run, and we also worked closely with a number of organisations across the globe, which we're going to talk about a little bit later, although that's still in the planning stage, but to try and have some sort of mentoring and peer support across the globe. And a number of our nurses, I think, were involved in a Facebook support as well, and peer support, which I think somebody else is going to be speaking about. So some really fantastic opportunities that really sort of sparked our imagination, and we engaged, and it was driven by our Band 6 nurses, as sort of a small group of people who came together to really drive and co-create this leadership programme for them.
Brilliant. Thanks, Roisin. And, thank you for all your hard work and support, being an early adopter of the Nightingale Challenge and working with us on partnerships, and really seeing it as that opportunity to not only recruit future nurses, but also retain the ones we've got. And I think that's one of the strongest things about this programme, the potential it has to retain and energise our nurses so that they don't leave us. Thank you so much for that. I'd like now to try Joe, if Joe can hear us. Joe, can you hear us? No, can Romnick hear us now?
Joe, I think Joe was frozen, but he was going to be on. He said he can hear us. Joe? Malawi? Okay. Put in Romnick.
I wonder if Romnick can hear us. Romnick can hear. Romnick, maybe turn your video off. And if you could just speak to us, then that would be great, because Romnick can hear you, Sheila. Romnick, can you hear me?
Yeah, Romnick can hear.
Can he? Okay, Romnick. So the question to you is, you succeeded in engaging public and private hospitals in the province of Laguna in the Nightingale Challenge. Why did you feel compelled to do this? And how can we encourage the early career nurses to advocate for the profession? I'm thinking perhaps Romnick can't hear now.
I think he can hear. I just don't think his microphone and video is working.
Right. So, Romnick, do you want to put into the chat box how you succeeded in engaging public and private hospitals in Laguna? because it's such an inspirational story. I'd so love for people to hear how you managed to do this.
Romnick, put on your mic. It may be muted.
I don't think we can, and we're not
No.
going to get.
Let's go for Joe. Joe can hear us.
Can you hear us now? Oh, lovely. Okay, Joe. Can you remember your question, or shall I give it you again?
No, he didn't have a question. Give it to him again.
Joe, the question for you is: thanks for your involvement with the Nightingale Challenge. You were able to receive funding to support the creation of a leadership development programme. How have you been using these funds over the last year?
Thank you, Lisa. So just an introduction. My name is John Conjera. I'm a senior nursing and midwifery officer based at Cromwell District Hospital, and I'm one of the attendees for last year's pre-World Health Assembly in Geneva. And currently, I'm part of the team, National Task Force, that is championing nursing now and the Nightingale Challenge activities in Malawi. We launched the campaign last year in May 2019, and we formulated a national task force for the existing quad. So the quad comprises of the education body, regulatory body, policy and practice, as well as professional institutions. So the team from this task force was given the mandate to look at the campaign to facilitate the implementation of campaign, including the Nightingale Challenge, and also to mobilize the resources that may be needed for the campaign, and to provide the necessary direction as needed. So we conducted a number of advocacy meetings with our main stakeholders, including the Ministry of Health, Parliamentary Committee on Health, local government, and as well as the government organizations. Now, regarding the Nightingale Challenge, we conducted some planning meetings with support from our partner SEED Global, and the focus was to outline the roadmap for the activities to be implemented under Nightingale Challenge. Of course, prior to initiating the Nightingale Challenge, we thought we should launch the Year of the Nurses 2020, and the launch was planned to be done in March, which was affected by the COVID. Of course, I'll talk more about COVID. And then we also planned to have the Nightingale Challenge, which is a mentorship program for the young nurse leaders age below 35. Also, the team was tasked to mobilize resources, so we came up with some proposals and budgets, which were submitted to our potential donors, including Barnet Trust for Nursing. We also had a task to make sure that we work on media and publicity strategies. So we came up with different pages on social media platform, including Facebook, Twitter, WhatsApp, among other things, to make sure that we're able to reach out to our nurses and the rest of the public. So to give a progress on the Nightingale Challenge, we've managed to identify 35. We have managed to identify 50 young nurse leaders from about 25 institutions, and the aim of the mentorship program is that we want to help these young leaders to become leaders, innovators, as well as advocates within the multidisciplinary team through this mentorship program. So the activities that we're doing, apart from the leadership that we have a team at national level, we've also managed to come up with the curriculum which will be used to facilitate the mentorship program. which will be a facility-based, considering that we're taking about 2 per facility in 25 institutions across the country. So we'll have at least 2 per facility and then 1 mentor. So they will be paired. The mentor and mentee will be paired at that particular facility, and they will all come for orientation meeting prior to the mentorship program. The curriculum has some core competences of leadership in for young nurses, and these includes character of leader, personal capacity development, focus on results, interpersonal relationship skills, and also leading organization for change. We came up with these competences after making some consultations with the quad, which involves the academia, like I said, as well as the practice. So we were able to come up with the special needs that these young leaders need for them to be able to execute leadership in their multidisciplinary team. So so far we've managed to come up with the curriculum, like I said, identified the 50 nurses and the 25 mentors. We're intending to start this in April, but due to COVID-19, a number of activities were put on hold, including the launch. We had to put on hold the launch, citing the social distancing issues and the restriction in movement. And also the orientation was not conducted because it was going to involve people gathering at one place. So we also had to put it on hold. And also the Burnett Trust for Nursing were supposed to provide us with funding for the mentorship program, but due to some restrictions also in UK, they didn't manage to finalize the processing of funds that were designated for the project. So moving forward, with considering that now we are having some restrictions being eased, we've written the Burnett Trust for Nursing to consider releasing the funds so that we're able to start implementing our plan in this coming month of July. So we'll just start with the orientation and then implementation, followed by the monitoring and evaluation aspect.
Fantastic.
Yeah, so thank you.
Yeah.
We are delighted to acknowledge few of these sponsors, including my government, Burnett Trust, UNFPA Malawi, Seed Global, and our professional organization within Malawi. Thank you.
Thanks so much, Joe. And just to say, every time I speak to Joe, I'm inspired and energized at the passion, the tenacity, and the ability just to make change happen, like so many of you. So thank you again for that story. And this is recorded for those that are having problems. And we are writing up the case studies so people can see what other people are doing as well. And we'll make sure people get this information, because it truly shows the power of these fantastic change agents that are right in front of our eyes. So I'm going to try again now to go to Romnick. Romnick, how are you doing? Can you hear us now?
Yes, I can hear you, Lisa. Can you hear me?
We can hear you loud and clear. Oh,
hello, Lisa.
I'm so pleased.
Can you hear me?
We can hear you. Yeah. So,
okay.
So Romnick,
finally,
yeah, worth
okay.
the wait. Always worth the wait. Romnick, what I'd like you to share with colleagues is how you managed to succeed in engaging public and private hospitals in the province of Laguna in the Nightingale Challenge, and why did you feel compelled to do this, and how do you see it encouraging nurses to advocate more for the profession and their patients and local communities?
Okay. So before I answer the question, can I give some background regarding the Nightingale Challenge in the Philippines? Well, it all started in the International Council of Nurses in the Free World Health Assembly. Just to give you a story, while I am in the plane going back to the Philippines, I am thinking of a program on how I can continue what we have started in the Free World Health Assembly. And I realized something, that networking will be effective if I will be collaborating the public and private hospital in my province with my ultimate goal that will benefit the young nurses. Then it snaps in my mind that the Nightingale Challenge will be the perfect program. With this, I started to plan on how I can move the province of Laguna to launch this one-of-a-kind program. I have reached out the Laguna nurse administrators, a group of nurse executives working in public and private hospitals, and also the regional level of the National Nursing Association, which is the Philippine Nurses Association. I believe we need to expand our advocacy and we need to be heard at all levels. I presented to them the Nightingale Challenge and proposed a launching and a program. I am surprised that they unanimously agreed in my proposal and believe in our advocacy. Series of meetings takes place to discuss the program of the event, creation of committees, invitations for guest speakers, and the launching that should be interesting and unique. So we invited the Philippine Nurses Association chapter president for the province, the Integrated Midwives Association of the Philippines provincial chapter, the president, and the executive committee officer of the National Nursing Association. I have also given an opportunity to share my experience and learnings in the Nursing Now Free World Health Assembly and about the Nightingale Challenge. We also launched acceptance and signing of pledge of commitment for the Nightingale Challenge and on-the-spot online registration for the Nightingale Challenge. We also made an open forum to establish linkages among in the province of Laguna and shared ideas regarding what program and the budget for the Nightingale Challenge. Early this year, we have also given an opportunity to coordinate with the National Nursing Association executives and the Association of Nursing Service Administrators of the Philippines for training courses for young nurses. We have been discussing with my colleagues in our province when the pandemic strikes. Everyone is not prepared for this coronavirus, and we need to put hold the face-to-face training. And just recently, we are considering a mixed online training program and a face-to-face workshop for young nurses. This pandemic will never stop us to continue what we have started, and we will stand in our commitment for young nurses in the Nightingale Challenge Philippines. And for the answer regarding the two questions, regarding how did I compelled to do this, I want to continue what I have learned and experienced in the Pre-World Health Assembly, and I want to share the investment given to me to other young nurses. I want them to feel that their voice is equally important in shaping the nursing profession in the Philippines. How can we encourage nurses to advocate for the profession? Make them realize that we are the steward of our profession. Give them support to continue his or her education, to be heard their ideas and listen to their concerns. Let us remember that nurses are the ones who are there from morning, evening, and nights, and they know how the hospital works. Involve them in research, decision-making, and politics, or with professional organization. We need to keep in mind that working to improve the profession also benefits patient care. Thank you,
Well,
Lisa.
thank you, Romnick. Absolutely fantastic. Now, we're doing quite good on time, but we've got about 7 minutes left. And I don't think our last person, Jeremiah, has made it, unfortunately. But again, we'll write up these case studies so that you can see some of the fantastic work that's going on. But Sheila, I think it's now over to you to kind of wrap the session up. And despite the challenges, I feel super inspired by everything that I have heard. So over to you, Sheila, and many thanks, colleagues, for sharing your stories with us.
So Jeremiah is not on.
No, we did.
Okay, I'm just seeing a blank. Okay, and I'm not seeing anything in the Q&A either, so that we can be able to wrap up this session. But to simply say thank you very much despite the problems that we've encountered, but I guess you all are aware that we're having people from all over the world, Australia, Philippines, Kenya, Uganda, and so we are bound to have some snacks here and there. But the main thing is that if you've been able to go to listen in or actually go in online through video, you have been able to hear the variety of leadership development programs that are being implemented all over the world. Some are even academic. And in this coming week, I will be addressing the council or the consortium of universities on global health on the Nursing Now, which will, of course, include the Nightingale Challenge, because I'm sure they also believe that as universities in global health, they should be able to implement some leadership programs for young nurses. So with that, it's really to say, well, you have seen, we have been able to share with you what is happening in other countries, but we need to know more. Go onto the website of the Nursing Now and the Nightingale Challenge and put in what you are doing. And I want to reiterate that we want this to continue beyond July 2021. So that, but for now, between now and July 2021, I, as an African, I need to see more of Western and Central Africa. I have been able to involve with Nigeria and Ghana in launching the Nursing Now activities. And I know there's a Nightingale Challenge, being implemented in those countries, but we haven't heard from the other countries. So please get in touch with us. If it means coming there on an advocacy mission with your ministers or whatever, I am available. I can be able to be sent by Nursing Now to see what is happening, because we don't want you to be left behind. So not just Western and Central Africa, but if there's any country in Asia that feels you are being left behind, do get in touch. We don't want to leave any emerging, person, emerging nurse or midwife behind. So with that, let me just say thank you very much. And I want to thank my co-chair, Lisa, for the great work. I want to thank the speakers, and I want to thank all of you, the participants, to say we'll be on again in the afternoon. So do go in and you'll be able to hear the experiences of other countries, as well as our closing session in the late afternoon. So adios. Thank you very much.
checking in.